Good Sunday afternoon, everyone, and welcome to Up Close and Cultural with Dr. Kara. It is good to be with you guys again. Um, First, I would like for you guys to take a moment and whatever platform you are streaming us on, I just want everyone to know that you can find us on Facebook, Instagram, YouTube, Twitter, Periscope, Twitch, and the TuneIn app. You can also find us at KUAW.org. So take a moment and like, comment, and definitely subscribe to the channels, regardless of which ever social media platform you decide to use. Also, there is a number at the bottom of the screen that you could also call in with your questions and participate with the discussion as well. Today, I want to go over some emails that I received that I am going to condense because there have been a lot of things going on in social media over the past month or so, I would say, that involve a lot of different people, from celebrities just to people in your hometown and people who are instant celebrities for various reasons, be it through wonderful and spectacular things that have happened in their lives, and then sometimes some unfortunate things that have happened as well. So I'm not going to do a dive into specific occurrences. However, I might mention a few of them. But the main thing that has come up that I saw from the comment and the email I've seen, which is I'm finding is interesting, and the questions that I received and from the comments is going over for me the lack of knowledge that people have about the mental health field and what mental illness is versus mental health. So that's what I want to talk about today, as well as some very common terms that we also use so much, and why we use those terms, and in us using those terms, such as calling someone bipolar or using the term gaslighting, and also, what is another common term? Trauma bonding. How those terms are just used. I hear them so much every day. And being someone who is in the mental health profession, once you learn what those words actually mean, and then you hear someone say them, I had to learn to not get alarmed because the population at large does not know what the clinical definition. Well, actually, there's only one definition of those words, but I'll talk about that in a moment. So those are the things that I want to get into today. And I think that in order to address the things that have happened in our world today and in the media, we first need to understand the words that we use, because language matters. And if we can't communicate on the same field or the same playing field on the same level, then that is how a lot of confusion starts. And then it also can be a hindrance to any progress being made. So, with that being said, first I want to talk about exactly what mental health versus mental illness is. So the terms they are sometimes interchanged, but they vary, they differ significantly in meaning. And when you if you think about it, it's also like referring to physical illness and physical fitness. So you have your mental fitness, and then you have your physical health, and then you have a physical illness. And if you can see those two things in your mind as being different, then you can understand how mental health and mental illness are two different things, and how even though they are used interchangeably, they should not be. So while mental health refers to anyone's state of mental, emotional well-being, mental illnesses they are diagnosed conditions, actual diagnosed conditions by a licensed clinician that affect your thoughts and your behaviors. So anyone can have a poor mental health moment, or anyone can have poor mental health, and not everyone has a mental illness. So also on the other hand, someone with a mental illness can also achieve sound mental health. And that's very important, because there's this stigma behind mental illness, and people are often discounted and discarded, which is why there is such a taboo subject, and why so many people are reluctant to get mental health treatment, because they are sometimes ostracized, because they have been trained or conditioned through false information to believe that if you have a mental illness, then you are somehow incapable, or you will perform substandardly, or you aren't able to achieve what the next person achieves. And that just isn't true. That would also, again, going back to physical health and physical illness, means that if someone has a physical health injury, even though they may be injured, you go to the doctor and you get help. And in hopes that if you follow the program that the doctor gives you, in time, you will get better. But that does not mean that in between that time that you cannot go to work and continue to perform your job duties. Some of them may be limited, and depending on what your job is, you may still be able to perform all of your job duties. And then also, let me throw this in there. When it comes to mental illness and doing what the doctor tells you to do or advises you to do, and comparing it to your physical health, sometimes when you go to the doctor, it can be trial and error. One medication may work, it may not work, or you may have some resistance to a medication. You may have a body can build up tolerance to a medication. A body may reject some medication. You also may find that a medication does not work well for you. So in that, a person does not have a problem going back to their doctor and say, hey, something is wrong. This isn't working out for me. So can we talk about this medication and do something different with it? And the doctor will change it. And the doctor will do what they can to make it better. But when it comes to mental illness, people don't take the same approach. When there's medication prescribed, along with other things, and understand that medication and therapy work hand in hand. And all the time, medication is not needed. But I'm talking about those times when medication is needed, okay? Because there's also this thing where psychiatrists have been labeled as these people that just want to drug you up and that is somehow going to make you better. And that is not the case at all. I personally prefer to try every method available before medication or try to find natural remedies, especially when it comes to depression. And I'm not talking about serious and severe mental illnesses such as schizophrenia and psychoaffective disorders, where medication is absolutely necessary. But going back to the point, when you are prescribed medications by a psychiatrist or an APRN, whoever prescribes your medication, people sometimes give up. Or you don't go back to your doctor and say, hey, this medication is making me feel funny, or I don't think this is working. Can we try something different? You would just stop and you won't try anything different and you give up. So I want people to just keep that in mind because along with the medication that you get from your doctor for your physical illness, you also get a list of side effects. And every medication has a side effect. Please hear me on that, okay? Um, you also get a list of side effects from your pharmacist in regards to psychotropic drugs. It is perfectly okay for you to exercise your right as a patient to speak to your doctor about those side effects because you need to know what's going to happen or what could possibly happen. And believe it, more often than not, there are people who experience no side effects at all. And then those who do experience the ones that are mild in nature and that will subside in just a few weeks. So with that being said, I am trying to drill in your mind that when you think about mental health versus mental illness, if you can go back and just compare it to and just switch the words and think of physical health versus physical illness. And I think that that will be the start of a better understanding of how these two words or two terms, mental health and mental illness, are that how they are not interchangeable and should not be used the same. So, um, also this month, I would say, let me pause and say that this month, the month of November, if you follow me on social media, you have seen me posting a lot. Um, I am uh, absent from Facebook and some of my IG profiles for a little while. But either way, you have seen me on there posting about Movember, and it's not a typo. It is Movember, as we call it in the mental health field, because the month of November is where we acknowledge Men's Mental Health Month. So I just want to take a moment and just say to everyone out there, please read the information. And if you are a male who is struggling with mental health, or if you are struggling with mental illness, especially, please know that it is more than okay to speak up. The term that I have been putting out there is that manning up is speaking up. So if you need help or if you just need someone to talk to, you should reach out to a mental health provider. There are a lot of men in this field. If you do not feel comfortable talking to a female, there are so many wonderful mental health professionals, from life coaches to therapists to licensed clinical social workers, licensed clinical counselors, and also psychiatrists and psychotherapists, behavior analysis in this field that can help you. If you do not know the names of anyone and need some referrals, or if you want to contact my office, I can do either. You can just visit my website, www.betterdayscounseling@lifecoaching.com. There is all, and shoot me an email. And there's also a text messaging feature on there. And you can send me a message and it will go to any of the staff members. And there is a wait time. Well, I don't want to say a wait time. What I'm trying to say is that all of your questions will be answered within a 30 minutes to an hour time frame. So please know that it will, that someone will get it. So just be patient and know that if you do send us a message, it will not be hours, days, or weeks before you hear from someone. That you will get a message from someone, and I would just say within an hour at the latest. Again, my website is www.betterdayscounseling@lifecoaching.com, and just go there and send us a message, and we can find a referral for you in your area, in your city. And it's okay to put on there what you are looking for. If you want a male counselor or psychiatrist, if you're looking for someone who can prescribe medication, if you're looking for a life coach, or if you are looking for someone um, temporarily to just get you over a hurdle of some kind. Maybe you have experienced a death in the family and you just need someone to maybe talk you through the grieving process or help you cope with the grieving process. Or if you are or know someone who is struggling with mental illness and you don't know how to support them. Or if you are someone who is struggling with mental illness and you need help and support yourself, by all means, contact my office, and we do not mind finding someone for you if you are not in our area. I prefer that you use my services for my company, of course, but I definitely advocate and promote a lot of great therapists and psychiatrists and counselors in the Kansas City area, and also in Georgia and Alabama as well. So again, um, with it being Men's Mental Health Month or November, as I said, is not a typo. Also, just be aware of the men who are around you. Strength does not mean not talking. Men cry too. Men have moments just as well as we do, and men deal with a lot that often go unspoken. And believe it or not, as you will see on one of the posts that I have, that the suicide rate for men has increased to 4 times that of women. And the CDC just put that information out at the end of last year. So again, with this being November and Men's Mental Health Month, I encourage the men who are out there to know that it is okay to seek mental health treatment, and know that you do have a support system that does not think anything less of you and actually support you in your process or your journey to um, to better health, which is something that we all strive for. So also, when we talk about mental health, your mental health is definitely, because I want to just talk a little bit about that before I get into the terms. It is about your overall, it's about your mental well-being. So according to the WHO, which is the World Health Organization, you will hear me say them a lot, the WHO, or the CDC, which is the Centers for Disease Control. Someone who is mentally well can realize their potential, cope with normal stressors in life, such as death, and contribute death or loss, and contribute to their community in a positive and productive way. Whereas your mental health it's about physical, mental, and social well-being. Your mental health, or should I say good mental health, allows you to live a fulfilling, satisfying, and great life, even while you deal with everyday challenges. Okay. And what that means is knowing that all of us deal with something, regardless of what that is. And when you deal with something something that is supposed to make you sad, such as death or losing a job or breaking up with someone or having someone break up with you, those are normal things that happen to us all the time, every day. And if you choose to cry about that or be sad about that, that's normal. That does not mean that you are suffering from depression. You may be depressed and you may be sad, and it's okay. It is more than okay. You should feel those feelings and go through those feelings and process through those feelings. But when it comes to diagnosis of being a diagnosis of depression, which there are various varying degrees of depression, there is a list of criteria that we get from the DSM, which is the Diagnostic Statistical Manual that we use to actually give a diagnosis to someone. So understand, so that is what that statement means. This is not about things that are normal and that you should go through and that you should experience. It is about when those things are out of hand and out of control and keep you from operating. But I'll get into that in a moment because that'll dig into mental illness. So with mental illness, factors like traumatic events, can affect your mental health, um, whether or not you have a mental illness. Okay. So things like, especially in the African American community, discrimination, exclusion, or poor physical health can also impact your mental well being. So, um, the way that you promote good mental health with yourself and everyone around you. Again, going back to men's mental health as well, trying to, throw some things in where I can, as well as your family members, is I would say there are about, I would say 5 things that I always tell people. You can provide your children with stable, nurturing, protective environments and structure. Um, you empowering and lifting up marginalized and discriminalized groups, empowering communities and preventing violence where you can, offering mental health interventions and programs. And what that means is allowing space for people to be able to process what they need to process. That does not mean that you are a counselor yourself. There are churches that have or mental health services, and they offer pastoral counseling. Is what I'm trying to say. And then also with that is not stigmatizing it. Okay. If someone says they need help, offer support and encouragement, or don't say anything at all. Just don't do anything negative. Okay. And the last thing is providing treatment for mental illnesses with therapy, medication, and what other methods, that are needed. So an individual or anyone, can improve their mental well-being by making positive lifestyle adjustments and pursuing a sense of purpose in your life. Wake up knowing that you are here for a reason and walk according to that. A person's mental health is going to vary throughout your life because your life is going to change every day. And it depends on outside factors. Again, a mental illness does not bar someone from achieving good mental health at all. With support, anyone can improve their mental health, hands down. So when we talk about mental illness, and this is the big difference, okay? A mental illness is a diagnosable disorder, not what your friends say, not what social media says, or especially not what someone says to you when they are angry or upset or trying to get you to agree with them. But mental illness is a diagnosable disorder with a standard set of criteria. And like I said before, those criteria, it's not our opinion. We pull those from the DSM manual that we have, okay? It can be caused by factors like genes, brain chemistry, or trauma. Um, Anyone can have a mental illness. There is no one in this world who is who can't have one. Okay, anyone can have a mental illness regardless of age, your socioeconomic status, class, sex, or race. Mental illness does not discriminate. Okay, these are disorders, can also be called mental health conditions. And I think that that probably sometimes leads to the confusion. But either way, mental illnesses they complicate your mental health by affecting the way you feel, think, act, and experience the world and the people around you. So, different mental illnesses have different symptoms, okay? Some of which take effort to work through. Some of the most common mental illnesses are, I would say, depression, anxiety, um, bipolar disorder, OCD, which is obsessive compulsive disorder. I think that those are the main ones, the major ones that we often hear so much about. But in essence, just know that mental health and mental illness, they are not the same. Mental health affects all people, while only some experience diagnosed mental illnesses. Okay, so I just hope that you realize that, or just know that it's helpful to realize that mental illness does not always lead to poor mental health, and that poor mental health is not always due to mental illness. All right, life events or other factors can affect anyone's mental health, whether or not whether or not a mental illness is present. Okay, so I hope that brings a little bit more clarity to that, um, to the issue of mental health versus mental illness. If not, as always, you can contact me on the website, or send me a message or email, or contact me here at the radio station. So let's get into some of these terms. So um, I would say that, over the past few years, you've probably found yourself online, viewing and reacting to these bite-sized pieces of mental health information. The difficult part about navigating through Beyonce's internet, as I call it, is deciphering misinformation from disinformation, especially as it relates to our mental health. At times, in an attempt to better understand ourselves and the world around us, in an effort to try to make ourselves feel better, or to cure ourselves, as some people call it, you know or to make ourselves feel better, you're in this world, that we live in. We we digest and share, and that's the biggest thing. We share these pieces of information that we find that don't fully, or that we don't fully understand, that properly reflect our experiences. For example, I will start with the term bipolar. Um, and like I said, all of them. I'll throw in trauma bonding, gaslighting, and narcissism. All of these are terms that you've probably heard before, or maybe even used in everyday life. Um, I know these are terms that you have used in your everyday life, but I have to tell you, by far and by large, that you are using them incorrectly. So today I'm going to break down the definition of as many of them as I can get to. And I've noticed that people, so many on just about every social media platform I'm on, I've noticed people using and misusing these terms online. How and why that language was shared um, incorrectly, and kind of share suggestions on how to be mindful around the information that we share online. So I hope that this brings some sort of clarity to why it's important to know what you're talking about when you start talking about things as important as your mental health. So let's first talk about trauma bond, because I hear that a lot. I hear the trauma bonding more than I hear the term bipolar. So, unfortunately, I am mostly seeing this, and I will talk about my people first. And I'm talking about people in my field. I am mostly seeing it used by mental health professionals on the socials. I think that, therapists, and in all of our defense, because let me first say that I definitely support all of our mental health professionals out there. And I know that every time someone gets on social media to share this information, that their first inclination is to do no harm and to help everyone that they can. So I just want to put that out there first. But again, like I said before, we just have to be mindful of how everyone is internalizing the information that we put out there. But I think that that mental health clinicians have this way of trying to offer psychological education in these bite-sized formats, through images and pictures, which I use a lot, or IG stories, and carousels, which is the flashes of pictures, and I use those a lot as well. And in that, we've been introducing psychological language to the community, and people have seen it, they read it, and then they start to run with it. And and I accept that, because we all do it. I do it. So my thoughts, I think the mental health system, if we talk systemically, right, the reason we are doing this is because we know that most people don't have access to mental health care. And again, like I said before, I know that when our mental health clinicians approach this and write their blogs or their IG stories, or their carousels, that they are just trying to offer information from the best place possible. Uh, but either way, I know that people don't have. We all know that people, or most people, don't have access to great mental health care. And what we are doing is trying to offer a free way for people to get some access to something more than what they have, right? In an easy way. I think it's the thinking. So, and of course, if I'm wrong, please chime in on it. But I think it's spiraled a little out of control, and it's turned into an industry by people who are not in the mental health field. And I think that that is how people like the Kevin Samuels and people of that nature can come in and just feed information to you. And although some things may sound right, there's also something called confirmation bias, where if you are already thinking something to be true and someone says it and it is true, or if you start to go and try to find more information on it, your brain automatically goes to those things that already agree with what you're trying to say. Then that gives that person some sort of credibility. And then there's also this cognitive dissonance that some people have, where you block out what you know to be true and what you have seen to be true and what has proven to be true, but you still electively choose to ignore it to make yourself right. So um, that's what I mean by the industry. So you see a rise in people showing up, and he's not the only one. There's so many people. He was just the first one that popped in my head, because I did a TikTok, and I was just having a conversation with someone about it a little earlier. But either way, you have seen a rise in people showing up, offering advice, understand advice is not treatment. Um, it goes viral, and then all of a sudden they're an expert. Your clicks and views gives a person credence, and that's very dangerous. So, at any rate, back to all of the actual professionals. That kind of bite size psychological education, especially to people who have not been in therapy, um, can only regurgitate what they heard. People are only going to say what was told to them, but they can't properly apply it or define it. And it gets even worse as it's filtered down from person to person. So, a lot of us, a lot of mental health clinicians, we work with people who are navigating, or dealing with some kind of trauma and trauma of some kind. And, consequences of traumatic situations. And then you pair it with a lot of people needing relationship help. And now we've got this trauma bond, as people call it, and then we start talking about relationships that perhaps are unhealthy, or in a very casual way, with one another. And it's like, okay, so perhaps this is what's going on, and this is what happened to you because this is what happened to me. And then you latch on to this person, and then you form this relationship with them, and then that person becomes, your trauma buddy, and then you guys are connecting. And I was even standing around and I heard this conversation, and these people was like, "Oh, I was standing in line at the at the gas station, and she was talking to me about her man, and then I did this with my man, and then we formed this trauma bond." And I was like, "No, no, you didn't. No, no, that's not trauma bonding, okay?" So all of those things and finding that connection with the person might sound fun, but that is not a trauma bond. And when you, let me say this, the good thing about being able to offer information to the community through the social media platform, even in this bite-sized way that we do, is that people are talking about their mental health and it's becoming less taboo. And I love that for you. I love that for us. The cons are, or is that, they aren't using the correct verbiage. And like I said, it's like, oh, sis, I was trauma bonding with my sis in the sauna today. I was trauma bonding with my good girlfriend while we were out on a walk today. No, no, I'm like, no, you weren't. No, no. So, so people are using this term and really not talking about exactly what it is and what the dangers are that are involved when we trauma bond. Okay. So first of all, let's talk about what it is. Trauma bonding occurs when a person experiencing abuse develops an unhealthy attachment to their abuser. And thinking about it right now, let me say it one more time. Trauma bonding occurs when a person experiencing abuse develops an unhealthy attachment to their abuser. And they rationalize and sometimes even defend their abusive actions. They feel a sense of loyalty to this person. They will isolate from other people, um, and hope that the abuser's, behavior will sometimes change, or at some point will change. Trauma bonding is likened to Stockholm syndrome, if you've ever heard that term before. And just to give some context to this, what I can use, and I'm just using this as an example, and I guess maybe I have to use the word allegedly, would be someone who's popular in the social media scene right now would be those two people, Krishan Rock and and whoever her man is. I've forgotten his name just that fast, but the young lady and he, allegedly is abusive towards her. I mean, she's missing teeth and everything, and she will get on social media, have to put her teeth back in the mouth to talk about her stories. But they break up, they get back together, and she will make one TikTok or Instagram or whatever it is, because they're everywhere, where she is physically bruised, and she's saying that everyone should help her and not buy his albums and not follow him. And then after that, the very next day, if not that night, she's saying, "Oh, he didn't hit me. I fell down the stairs, or I fell down the car, fell out the car, and I love him, and we're going to have a baby. And then come watch us on Instagram tonight. And he loves me." So those are the types of things that is a trauma bond. Okay. Talking about what has happened or sharing your experiences of not having a good experience with someone is not trauma bonding. So when you come to someone like me and you say that you have a trauma bond, my ears perk up, because I am in my mind thinking, this person is being abused. What do I need to do? Because you also need to understand that mental health clinicians, we're something that's called mandated reporters. And if you tell us certain things, especially if we know that there are children in the home or children involved, if you tell me that you are involved in a trauma bond and that there is I'm thinking that there is an abuser in the home, and certain things you may tell me after that, I have to hotline it and I have to call it in. So you have to watch what you say to people. You can't say that you have a trauma bond with someone and you're just talking about how you and your girlfriend were just trauma bonding and chopping it up because both of your boyfriends sucked. That's not trauma bonding. And that's, also not anything that you should, kind of be celebrating anyway. But either way, that is what the term trauma bonding means. So understand, again, trauma bonding is relatable to Stockholm syndrome, and it involves the behavior between an abuser and the abusee, where the person who is being abused starts to rationalize the behavior of their abuser, and they form a very unhealthy attachment to them. They become very loyal to them. They will isolate themselves from their family, and they will continue to subject themselves to this abusive behavior in hopes that the abuser will change, hopefully thinking that they can love the abuser into becoming the person they thought they were when they first met. So back to, mental health clinicians, I think we came out with one intention, but as I stated earlier, it spiraled out of control and it became something else. So simply speaking about or ruminating on your trauma, or having these trauma bonding circles with people who've also experienced trauma like yours, and I hate using that word because I'm trying to get people to stop using it. It can be, it's always helpful for us to talk, about what we've been through, but it does not do anything if we gone away from the original definition of what the word is, and also if you're not receiving any help. So if you are just sitting around and just talking about what's wrong, then that's tantamount to complaining. And then you are not, it's not making you better. And you can also exasperate a situation and make yourself fall even deeper into the pits of whatever you're feeling. And let me say this, when it comes to therapy, there is a process to therapy. Understand that a trained mental health clinician, we know what we're doing. When you come into the office, you are not just there to start talking and then we just start talking back at you. Even in the initial intake, that's just not how it happens. And so, and I say that to say this, when you come into when you come into the office, the goal is to build you up and not to break you down. Because when you walk out the door, we know that that is when the actual work starts. And then also when you walk out of the door, we do the best that we can to make sure that you are in a good space, because we don't want to bring up all of these emotions in you and then tell you to get out. And now you're all sad and broke up and tore up and just out there in the world and don't know what to do. So in that engaging with a therapist, any of you who've ever been to therapy know that when you go to therapy, it's a healing process, and that in those sessions that you have, there are highs, and then and when I say highs, I mean where you start talking about whatever the issues may be, and then there's a rise because you're going to feel the emotions, whatever that emotion may be, and then you're going to balance back out, which is the goal, so that you will leave feeling better, not cured, and sometimes not even healed all the time, because everything does not happen in one session, but you will at least feel more capable, or at least be armed with more information than when you came. So, but I would say that people, still don't understand the blurriness of what people experience as trauma versus things that are unpleasant, or unpleasant to think about. And I know that people remember, or that people remember from the past. We all have, unpleasant experiences from the past that are very, um, very traumatic for us. And I think it's because a lot of it gets lost because of how we are learning about this. And in we're learning about it in these little small sound bites, or in these bite-sized pieces. And because you are not working with someone who can really help you understand or discern that, because you remember something unpleasant that happened, doesn't mean that that was something, um, that was something traumatic happened that you didn't like, or was unexpected, or that was painful, for a while. Also doesn't mean that that was traumatic, excuse me, for you, right? So I think that even the conversation around trauma in and of itself, and then also trauma bonding, also really dilutes what people understand or accept about the human experience. And there are things that will happen that clearly are not okay, and that you didn't want to happen, to you, that you didn't like. But that doesn't always mean that you have been traumatized, right? So I think that, again, social media, unfortunately, can help promote that. We see a lot of these posts that say all the different things are trauma, right? You've been traumatized if this happened, or this is a trauma response to something, and those things are just wrong, and just everything, all of that goes together in some way in which we've really diluted what trauma is, you know so, which I think it serves to be harmful to people, who have had traumatic experiences, by definition, who have had traumatic experiences. And now people are having a harder time naming that. They're more confused around, um, what they're feeling, which leads them to feel invalidated of some sorts, right? So then you're like, whoa, if what they're feeling is trauma, from their breakup is trauma, then, um, what are my experiences about? Is minimizing the seriousness of my trauma, and so you can experience things that are unpleasant and that are negative, and not necessarily mean that you have, I would say PTSD, because that's another term that people have heard before. Okay. So I just want people, words have meaning. And if you are going to at any time help, then it's proper to know what you're talking about. Okay. So now if someone, else endured something where harm or death or the idea of serious death was actually real, real to them, and they have nightmares about it. Um, they have these memories, severe anxiety. They're wanting for the other, or I would say waiting, for the other shoe to drop. And I'm listening, to what people say to me, so I can clearly identify, what's going on. And I'm listening to what they say about these experiences, versus what I hear to somebody says at the grocery store or in the sauna that was, traumatic for them. And they say they have PTSD as a result of that. And you're looking at this thing like, oh my gosh, like what has happened? And, and this isn't necessarily trauma, because I don't want to, you know, um, diminish anybody's experiences. But on the other hand, if you are having nightmares with the same scenario, if you are having nightmares and if you are having severe anxiety, if you are unable to function normally, as a result of what is happening to you over an extended period of time, then that requires a completely different intervention. And that is where someone like me versus maybe a life coach comes into play. But I think, we've gotten lost in the public awareness thing as well, and it's a growing conversation. And I think that all of us, it doesn't mean that everyone is going to be able to help. Okay. And I always try to come from a place where people are doing the best that they can. I honestly do believe that. And I know I'm not going to be able to get to the rest of those words, but I would just end with this. I believe that people legitimately are coming from the best place that they can, and they are doing the best that they can. In order to do that, we have to make sure that we are fully functional and that we are aware and that we are not lending our own experiences to what is going on with someone else. So, and what that means is when someone is having an issue or going through something, that is not the time to go, or I'll just use an example and just try to use something light. Understand, I'm just being facetious here. So if a person comes to you and they're very upset and they say, oh, my dog died, yada, yada, yada. That is not the time for you to interrupt them and go, oh, well, my dog died in 2015, or my dog died last week and this is what happened, and yada, yada. That starts to make it about you. And then it is no longer about that person and what they have come to you about. You have made that entire situation about you. Even though your intentions may have been great, that is not the proper thing to do. And so again, I do believe that everyone is coming from the best place that they can, but understand that there are a lot of misconceptions about mental health, all the way down to people thinking that therapy just means that you're in there listening to somebody give you their advice. There's training, there's schooling, there's licensing behind all of this. And it will behoove you to go to someone who is experienced. There are a lot of different types of therapy. If one does not work for you, just as there are a lot of different types of clinicians. If one doesn't work for you, it's okay to get a second opinion, just as you would if you had a physical illness. But don't give up. Do not at any point give up or think that there is not a way out of what you're going through, because you also need to understand that you are not the only one and you won't be the last one. But we are here. We are here for those reasons. We are qualified and we are trained. And when you see this information online, understand that it is given in these bite-sized chunks in 60 or 90-second reels, or in what is it, 140 characters that's on TikTok. But it is not TikTok. What is 140? The bird app, Twitter. That is 140 characters. So there is no way that we can sum up everything about a person in that small amount of time. So understand that when you see those things from mental health clinicians, it is not an all be all. We're just offering you snippets in hopes that you can recognize something and then take that. It is not for diagnosis. It is not for you to self-diagnose yourself. It is for you to see that, recognize something in it, and then take it to a qualified and trained professional who can help you, and then go from there. We try to put light on a situation and to spread awareness, just as we all do. And it's like a commercial, I would say. Even if it's just a commercial for, we just say a commercial for whatever that diagnosis is or whatever you're feeling. But just to give people some answers to some questions that they may not can afford to get normally or have access to. But know that when you see those things online, especially from mental health professionals, it is, and even from doctors too, it is not at all a complete diagnosis, and that is not all of the information about whatever that diagnosis is about you or your child or what you may go through. Because another thing is that when you see those things, like I mentioned about the nightmares and the anxiety and things that you may be experiencing, they have to happen. Another key is if they are happening over a certain extended period of time. Even with depression, you have to be depressed. You have to be experiencing depression over a certain amount of time, and along with some other factors before you are considered to be clinically depressed. Okay. So understand that we are here to help, and first and foremost, to not do any harm. So when you see these things online, by all means, take them, read them. We do hope that they are entertaining, just for the fact that they get people to engage and to talk, which, as I said before, lessen the stigma of mental illness, but to help you to move to a better point in your life. And again, take it to your clinician and get engaged in a therapeutic process. So thank you guys for joining in to Up Close and Cultural with Dr. Karasay. And you guys have a wonderful Thanksgiving, and I will see you all in December. Okay. Will do.